How to Manage Conflict Effectively, Dealing with Angry and Abusive Patients by Harpreet Chana from the Mental Wealth Academy, brought to you in association with the Royal Pharmaceutical Society and Pharmacist Support. The key thing to remember when dealing with conflict is CLAWE, C-L-A-W-E. Calm, listen, acknowledge, warning, end conversation. C, calm. You may be tempted to raise your voice, but don't. This will only make the angry patient become angrier. Be confident and firm and try to keep a calm voice at all times. It is the easiest way to deflate anger. L, listen. Actively listen to the patient's complaint by maintaining eye contact, nodding often, and not interrupting. Most people just want their complaint to be heard. If appropriate, repeat back key points to check your understanding and to show that you are actively listening. A, acknowledge. Acknowledge their complaint and show empathy. Again, most people just want to be heard and their inconvenience acknowledged and apologized for. Try to apologize for that inconvenience. For example, I understand that you are upset that you have not received your medicines, and I'm really sorry that you've had to come into the pharmacy to sort this out, but let me see how I can help you. W, warning. If the patient has not responded well to your calm voice, acknowledgement, and apology, and they continue to be abusive and/or angry, issue a warning. It's important to remain calm. Politely request that they not speak to you in that way and warn them that if they continue, you will have to terminate the conversation. For example, I understand why you are angry and I'm trying to help you, but if you continue to raise your voice and be abusive towards me, I will have to end this conversation. E, end the conversation. If they still do not desist, politely state that you are now ending the conversation. Ask them to leave the premises, and if they refuse, explain that you may have to call security or the police. For example, I have repeatedly asked you to not shout at me, but as you are continuing to do so, I have no alternative but to terminate the conversation and ask you to leave. At that point, leave the conversation. If they continue to be angry or abusive, come back to them and say, I am now asking you again to leave the premises. If you fail to do so, I will have to call the police. And at that point, be ready to carry out your warning if needed. For this reason, it may be helpful to agree your approach of managing conflict with your team first, so that they are all aware when security or the police should be called. So remember, CLAWE, calm, listen, acknowledge, warning, and end conversation. We have developed a handy fact sheet that you can download and place where you usually speak to patients, and you can use this to also agree your team's approach. The fact sheet can be found on the Mental Wealth Academy's Pharmacy Wellbeing Hub on Facebook, as well as our website, the RPS website, and Pharmacist Support website. Thank you for listening.